February is National Heart Health Month, and it is a crucial reminder for women to prioritize their cardiovascular well-being. Our friend, nurse practitioner Barb Dehn, joined us with tips to help us put our hearts first. All right, what are the most common heart disease symptoms in women?
Okay, Jess. Surprise, women are different than men in so many ways, including our symptoms of heart disease. So while a man might feel a chest pain that's really sharp, women feel pressure or tightness. A man might feel some pain down their arm, but a woman will feel jaw or throat pain, even abdominal or back pain. And some women will even have sweating or indigestion or even a little bit of nausea.
Oh, wow. Okay, so what are the major risk factors for heart disease and women?
We all know what these are, right? It's smoking, it's being overweight, it is not paying attention to our high cholesterol or our blood pressure. And I want to tell everyone something. Last year, my blood pressure was up and I was overweight. And I said to myself, okay, I can't ignore this anymore, because I wanted to ignore it. I wanted to be in denial. And I went on Weight Watchers, I lost 20 pounds, and my blood pressure came back to normal. Did you know that every time you lose 1 pound, you drop your blood pressure by 1 point? So weight loss and exercise is super, super important.
Yeah, that's incredible. Okay, so let's talk about lifestyle. What about things that are happening? Does stress, anxiety, and depression really play a role in women's heart health?
It sure does, because that stress causes a lot of constriction in blood vessels, and it also causes inflammation. And so think about the vessels that give blood to your heart. They're teeny, teeny, tiny. And if they have any atherosclerotic plaque from high cholesterol, if they're constricted, it means there can be no blood flow to the heart. That can cause angina or heart pain. It can also cause a heart attack.
Oh my goodness. Okay, so what are some common misconceptions about heart disease in women?
So guess what? Most women think they're not going to die of heart disease. They think that breast cancer is actually more likely, but breast cancer only impacts 1 in 8 women, while heart disease impacts 50% of women. So 1 in 2 women will have heart disease. So the biggest misconception out there is that I'm not at risk for heart disease. I can ignore my blood pressure. I don't have to exercise or quit smoking. But that's not true. We need to pay attention to our hearts.
Absolutely. All right, let's talk about the latest advancements in the prevention and treatment of heart disease in women.
Okay, it's never too early to start. And here's the latest breaking technology. We know that women who have high blood pressure in pregnancy are more risk of having heart disease later on in life. In the past, we thought, okay, pregnancy is over, you're fine, but that's not the case. So now we're recommending that any woman who has high blood pressure in pregnancy be followed with a cardiologist after giving birth and every year thereafter. The other advancements are that women aren't aware that heart disease is an issue, so we're really trying to increase awareness.
All right, and how do we advocate for heart health?
Okay, here's what I want everyone to do. Get a blood pressure cuff at home if you can, and take your blood pressure regularly and keep track of it, or get it checked at the grocery store or the pharmacy. Next, when you go in for your annual physical, do ask for a cholesterol panel. If you have a family history of heart disease before age 50, ask your provider to check you for Lp(a). This is a lipoprotein. It's like cholesterol that can cause early heart attack. But also advocate for yourself for those heart stress tests and those cardiac ultrasounds if you need it. Don't wait and say, well, it's not an issue for me. And if you have any pain or pressure or palpitations, do get it checked out. So be your own best advocate.
All right, fantastic. Thank you so much, Nurse Barb. Let's take care of those hearts, right?
Absolutely. Take care, everyone.